Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over the 4 common back surgery side effects that majority of the back surgeons do not share with their patient before the surgery. So it's good to be aware what's gonna happen after the surgery, what to expect as a side effect, a common side effect. Also, I will go over some of the research that done on the success rate of back surgery. It's very important to be aware that there is diagnosis or disease that called failed back surgery syndrome, and that is happen or that diagnosis has been commonly used because it's very common to have a failed back surgery. So by definition is failed back surgery syndrome is the pain may be originated after the surgery, or the surgery may be exacerbated your original pain. And by that definition, you might have failed back surgery if you went through back surgery and you still experience the pain or you have more symptoms. So the first report or study, they found that half of the patient that had undergone more than one spinal surgery, which means the first back surgery has failed and they had to go through a second surgery to correct or try to help relieve the symptoms that the first surgery failed to address. And the link for the study here, and I will include the link underneath this video. So the other research or report, they found that increase the complexity of back surgery, the more complex the surgery, the failure rate will range between 30 to 46%, especially for lumbar fusion, which is fusing the vertebra together. The third report, they found lumbar fusion rate failure rate is 30 to 46, which is correlate to this study. And also for lumbar decompression, the failure rate is 35 to 36. So based on this report, there is a chance of 30 to 50% that you might experience back failure surgery. So what are the symptoms that you might experience? You might experience stiffness, weaknesses, sharp stabbing pain, and numbness, tingling, and a lot of these symptoms that usually actually the symptoms that you start to have before someone recommend the back surgery. And you can see in this image that's for fusion, and there's a rod in the back here, and there's the screws to stabilize those vertebrae. There are some surgeries that needed as to save people from paralysis, but there's other surgeries that recommended that can be addressed, the pain can be addressed naturally based on those reports. So what are the 4 common side effects of back surgery? So one of the most common side effect and all the back pain patient has to go through it is pain. After the surgery, you will experience pain. The pain could be recurrent or continuous of symptoms. The second issue is, or common side effect, excessive scar tissue. The bigger the incision, as you see here, the more scarring you're gonna have. You have to have a scar tissue. The problem if you have excessive scar tissue that compress on your nerve, again, that will cause failure to your back surgery. And no one can guarantee how much scarring your body gonna produce, but that's a common side effect. And a lot of surgeons do not talk about that you're gonna have a scar tissue or you're gonna have pain after the surgery. The third side effect is inflammation, and you can see in the image here swelling. The problem with that is if you start to have swelling, that can compress on nerve or an artery and compress on your nerve, again and continuously causing the scar tissue. Okay, so you can see here, this is the front of your vertebra, your pelvic here, and you have your nerve coming out, you have your disc here and the vertebra in between. So the yellow tissue here is the nerve. So when you have inflammation internally, and a lot of those surgeries, they actually do a lot of cut, a lot of repair, and that cut, your normal healing cycle, your body has to build the inflammation as part of healing. The problem is after the cleaning that the surgeon done, if your body build excessive inflammation, it's gonna push on the nerve again, and that's also could contribute to at least 30 to 50% failure rate of back surgery. So the fourth side effect is nerve damage. So when you add scar tissue, you add inflammation from the surgery, that could cause nerve damage. That's if there is no complication or no mistake happened from the surgeon. So those are the common four side effects, and I will go over other side effect that's less common than those four, but most of the patient gonna experience the first four. That's part of the surgery. So you might have complication from wound infection, and as long as they use a good hygiene, there's a high chance you're not gonna have this issue. The other side effect could be dural tear, and you can see it here. This is, you see the brown line here, that is the dura mara, and that is actually kind of like a thick tissue that keep the spine in the middle and the spinal fluid in the middle, and the tissue that it's kind of like protective and actually enclosure for the spinal cord. The problem is if by mistake it happened during the surgery that there is a tear from needle or from a cut, that's you're gonna have a spinal fluid coming out, and that will cause dural tear, the leakage. The common side effect of that is headache. If you experience headache right after your surgery, reach out to your surgeon. There's a chance it could be a dural tear. That is one of the common symptoms of the dural tear is headache. And when someone has dural tear, the only thing they have to do is go back and repair it surgically. But if you start to have headache, reach out to your surgeon. So the other side effect is DVT, which is blood clot, and a lot of the time doctors give you medication to help to decrease the risk of having this issue. So hardware fracture happen, it could happen, you have metal screws, plates, and rods, and that is part of the hardware. You might have issue with that. Lastly is death. So those are the common side effects, the ones that I mentioned earlier here, that could affect your recovery, and it could lead to a second or third back surgery. So one of the main questions that a lot of people ask me, so what should I do naturally to prevent back surgery? I will leave a link in the bottom on 3 natural steps that you can do at home to prevent, stop, or relieve your back pain. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.